Hi, I would like to talk about knee injuries. Knee injuries can be incredibly debilitating and incredibly expensive to fix. We need to understand that knee injuries, based on just kind of the trends going on right now in the country, will lead typically to more knee injuries to be expected just based on the dietary habits as well as the lifestyle choices that people are currently making. In an article from NBC on March 14, 2017 by Maggie Fox, she reported on a study done by the American Academy of Orthopedic Surgeons. And they found that in a study of 86,000 people with knee injuries, the actual surgeries and then treatments that would have to happen afterwards costed around $43 million collectively. It is staggeringly expensive. And doctors are trying to find a way around this in order to just to give better care to patients that are less costly. So, for example, Dr. Bernard, one of the doctors who was giving a presentation during this meeting, and when he published the actual study, he said that if you can get away with not doing surgery on someone, he said that is a win. Common knee injuries range anywhere from fractures of bones, from just basic trauma, to tearing of ligaments, such as like the tearing of the ACL, which can be extremely severe depending on the severity of the injury and the trauma that was put on the knee itself. You can have dislocation of the knee and the joint, and also you can have meniscal tears in the knee, just also based on just general wear and tear. Rates of obesity also affect the rates of knee injuries as well. Basically, when you have more weight on yourself, you're putting more weight on your knee when you're standing, walking, just doing normal things. So when you have 32.2% of men obese and 35.5% of women are obese, you can have a lot more knee injuries, and we've seen that from statistics. You've seen almost that they go up together on the graphs where you see knee injuries go up as obesity rates go up. So obesity is actually a common problem with knee injuries as well, including also physical activity, with trauma from, sports, for example. But obesity is actually one of the main factors in knee injuries. When we talk about knee injuries, we also need to talk about the recovery time that's involved, because there is a huge amount of recovery time that is needed for most surgeries, as well as also physical therapy that typically takes place afterwards in order to get back up to your normal strength. And depending on the severity of the injury, if it's really bad, it can take months just for you to get back to your normal state. It's very important to take care of yourself and look after yourself, specifically just your overall health. Knee injuries are incredibly important, and if we don't look after ourselves, we may just fall victim to them. So we want to make sure that we take care of our bodies and watch what we're doing when we're doing physical activity, such as playing sports. Always be careful and make sure that you don't overexert yourself, or you might just get these injuries yourself. So please, take care of yourself, and thank you for your time.